If you want to protect or prevent yourself from getting coronavirus, if you understand one thing, that is how it spreads, most of the things will be taken care of. See, when a sick person is there who is having a cough or whenever he sneezes, what happens is a small droplets of saliva spreads in the atmosphere, and if you're near, basically the range of that spread is around 1 to 2 meters. If you're in the range, if it settles on your face, your eyes or your mouth, that's where you can get infected. So you have a choice. Either you go away from that person or you give him a mask. That's one thing. Second thing, if say these virus particles are very heavy, they don't last in the atmosphere for a longer period, they settle down, and you should know where they settle down. They settle down on the surface of the laptop or your knob, your railing, your clothes, many things, whatever, your pen, your mobile phone, wherever. And if somebody touches that or you touch it unknowingly or knowingly, and what is the common thing which we see in a person's attitude is he very frequently touches his face, rubs his eyes, or sometimes picks his nose also. If the hands are infected, if you do those activity, you will get infected. So how to prevent them? One is the surface where you have touched, you feel that the infected person has touched, you should feel that it is been touched by this person. Hand wash. Hand wash is not like you just wash your hands with water. Soap the hand, and till here wash, scrub for at least 20 seconds. Then you can touch your face also if you feel like for some reason. Second thing is the surface has to be cleaned with soap. The virus doesn't last longer than 12 to 24 hours on that surface. So if you clean with the soap, most of the things will be taken care of. Third, very important thing is to prevent this, commonly we handshake people. The best thing is the namaste. That's the best way to prevent. Second important is before you have your food, wash your hands. Before you go to the public place, come back, wash your hands before any activity. And if you are suspecting anybody of your family affected by this, don't use your utensils, common utensils, the plates, the towels and all, you should not use. And also consult the doctor. There are so many people who will be suggesting you take this tablet, these medicines, this Ayurvedic, this homeopathic. No for them, because nothing is better than going to the doctor, number one. Number two, the immunity, the person, you see people who have been infected, majority who had severe illnesses are beyond 40-50 years, who were diabetic, suffering from chronic disease or having some low immunity. So you boost your immunity. It is commonly seen that whose immunity is less, the viral infection catches. How to improve the immunity? Right food, vegetarian food. Number two, proper sleep. Number three, yoga and pranayam. Number four, include half a spoon of turmeric and a pinch of black pepper in your food. That will boost your immunity. And if somebody, you think that you are infected, don't ever panic, because 95 to 97%, if the immunity is good, it is a self-limiting disease. Now you have to take care about yourself and not to spread others. So wear mask. Any mask will do. You don't have to go for N95 mask. Second, the mask which you are using, if it is grossly contaminated, you can change for 2 to 3 times a day, but never use the same mask the next day. Keep your clothes aside, have a proper hand wash, and consult your doctor. If they want to keep you under investigations or isolation, cooperate with the doctors. No antibiotic is going to help in these conditions. And finally, my request to all the people, avoid going to crowded place unnecessary like malls, theater, when it is not required. So be safe, be healthy, not to worry about coronavirus if you know the intricacies what I have said. Thank you.